Everyone, so wonderful to see you all. Thank you so much for joining. And it's great to see all of you joining in good numbers. So I can only imagine how much curiosity and inquisitiveness that there may be regarding today's session. So it's wonderful to have you all. Thank you so much. And in case you're joining us for the first time, just for the uninitiated, I'll give a quick introduction about myself and about the organizers for today's talk, that is Silver Talkies. So my name is Nidhi, and I am the co-founder and CEO of Silver Talkies. Silver Talkies is primarily a community and engagement platform exclusively for the 55 plus, and we have been working in this space since 2014. And our whole mission of our work has been how to create a community of vibrant older adults, a vibrant community of people who want to live a happy, healthy, and active life. And we run something called a Silver Talkies Club, where anybody who's 55 plus can become a member by paying an annual subscription fee, which is as little as 4,000 rupees for the entire year, which kind of amounts to, say, about 333 rupees a month. And once you become a member, of course, you get access to this very, a group of very interesting, very inspiring, very active, very learned group of people. Currently, we have members in 15 different cities across the country. But we do have city chapters in Bangalore, in Chennai, in Delhi NCR, in Pune, in Mumbai, and in Hyderabad. So we have 6 city chapters where we also get to meet our members almost every 2 months. We have a meetup in these cities. And on an ongoing basis, every month we have about 15 different sessions on different topics like health, wellness, legal, financial issues, even fun events like storytelling, quizzing. We have our members coming and sharing their own learnings and what they have learned. We recently had somebody taking a 4 session long course on German language. Another member took a session on blockchain. So we encourage our members to come and share their knowledge and their wisdom as well. So if you have that kind of zeal and you also want to be part of this kind of a very like-minded group, we welcome you to become a member of Silver Talkies, and you can find all about us at silvertalkies.com. That's our website. And we are, of course, available on Instagram and Facebook also. And we, in fact, the Bangalore group is going for a day trip to Mysore on an art and heritage trip to Mysore. We are going to Varnam Craft Collective on September 8th. So we try and organize very different and unique kind of concepts, which usually people will not kind of do it on their own. And of course, doing it in a group makes it all the more fun and interesting. So that's the little bit about Silver Talkies. And today's event is presented in collaboration with Bridge Health. Bridge Health is an integrated medical and digital healthcare provider designed to deliver individualized care continuum proactively. Bridge Health believes that a proactive focus on personalized healthcare and swift curative and preventive actions to mitigate risk are of paramount importance to each one of us. And their journey is all about being your trusted healthcare companion for life. So thank you so much, Karan, Tanvi, Nishta, for making this possible. And thank you, Ashish, for getting us connected to Bridge Health to make today's presentation possible. Now, let me just quickly introduce our speaker, Dr. Dhanya Prabhu Ramadas, who is the head of clinical services at Bridge Health. She's a family physician who believes in providing evidence-based holistic care to all her patients. Her fields of interest are geriatrics, neurology, women and child health, and lifestyle medicine. She completed her DNB from Bangalore Baptist Hospital, and after that she completed her MRCGP, and she's a member of the Academy of Family Physicians of India and is certified by the Karnataka Medical Council. So a warm welcome, Dr. Dhanya. Thank you so much for sparing time from your busy schedule and being here to educate us about shingles. But before I start, I usually try and, get a sense, a pulse of what has brought people here. So can I just know by show of hands, how many of you have heard of herpes zoster? Shingles, I don't know if you knew the name or not. Okay, I see Geeta raising her hand. Madhu is raising her hand. Daisy, Ashok, Lakshmi. Okay, Ravi. How about others? Okay, I see some more thumbs up coming up. And do you know of any family member or friend in your family who has actually suffered from it? Who's gone?
My mother's gone through it, an unbearable pain.
Unbearable pain.
Yeah, my mother-in-law also.
Right.
My mother-in-law also. Yeah.
Yeah. So
my mother also.
I've seen a couple of friends, and one friend, she suffered for more than 2 years post herpetic neuralgia and all those things. I've seen 1 or 2 severe cases.
Yeah, so I am hoping Dr. Dhanya will cover actually about all those complexities as well, because this is something which came to my attention as well when a few people shared that even though, the condition was over, but the pain actually has lasted much longer, even beyond. And I am very curious to know why and how of it, and how does one get really cured of that. So thank you so much for everyone for joining. So I think that way it's a blessing that we do now have a vaccine brought in India by GlaxoSmithKline to really help us, prevent contracting herpes. So over to you, Dr. Dhanya. And we will also let you know about how can you get vaccinated, because we do have a tie-up with Bridge Health to make this vaccination possible across communities in Bangalore. And even if you belong to another city, we will definitely work with GSK and other partners to make sure that you are not left behind. So we will work on that as well. So at the end of the whole today's session, we would be sending you an email with a sign-up form where you can actually let us know if you would want to get vaccinated, so that we can work with you to make it happen. Okay. So thank you so much, and over to you, Dr. Dhanya.
Thank you. So I'm going to correct my name a bit from what Vidhi has mentioned. So my name is Dr. Dhanya Prabhu Ramadas. So I work with Bridge Health, and the rest of the information that is provided is spot on. So thank you so much to all of you who are present here on this evening, when you could have been doing a lot of other things, interesting stuff. But I think it's very important to understand about the condition that I'm going to speak today, which is shingles. Allow me to share my screen now. All right. So today we are going to speak about a very important and a very upcoming problem that is going to be faced by the adult population, the older adult population, and that is shingles. Like what Nidhi had first initiated, I think a lot of you are aware of this condition, but today we are going to dwell into a little more deeper insight into how this presents, how is that you're going to recognize having had this disease, and of course seeing other people have this disease, and also coming up with preventive aspect of shingles. So let me move on to the presentation. So today we're going to have an overview about shingles, very commonly called, and its causes. What causes the shingles? How common is shingles? Of course, it is common when I see so many of you aware of it. So it is common. And how to recognize the symptoms, and why early treatment is essential. Of course, by treatment, we see that you need to be aware that how to recognize it, and also go to a healthcare provider at the earliest. The possible complications of shingles, whether you are at risk or not, or whether somebody in your family is at risk or not, and prevention of shingles with a vaccine, which will take off all the other implications here of shingles itself, like complications and the treatment. So what is shingles? So way back in the 19th century, shingles was considered a very mysterious disease. Why was it mysterious? Because a lot of people, including healthcare, used to wonder, why is it occurring only on one side of the body? Why does it occur in a single patch, usually found on the body, on the trunk, right? So shingles is a disorder of the nerve. That means it's a disease of the nerve, which is characterized by a very painful skin rash. So that's like characteristic. All of you said it's painful and the pain lasted many years. So all of you are aware that it is a skin rash, but it's not a skin disease. It's actually a disease of the nerve. And it is also known as herpes zoster. So we used to wonder why this is only on one side of the body. And when we realized that this is a disease that occurs in nerves, we know that the nerves that supply the part of the skin comes out of the spinal cord and goes on either side of the midline. That means on either side of the body. And then from sensations from the skin is taken back to the spinal cord and then to the brain to feel any kind of pain, temperature, pressure, things like that. So that is why the nerve disorder, that is shingles, presents only on one side like a band, right? It is caused by a virus. So we are all aware, and I think the common thing that we see in childhood is chickenpox. So this is the same virus that causes chickenpox, which also causes shingles. And it is called as the Varicella-Zoster virus. That's why it's called Herpes Zoster, because they belong to a family of viruses called herpes. After someone recovers from a chickenpox, what happens? So most of us have got chickenpox while we are, in our childhood, but some of them also get it in adulthood. So once we recover from chickenpox, this virus remains alive but silent, what we call as dormant in the nerve tissues. So usually after many years after chickenpox, that is, ideally we see now after 50 years of age, when the immunity also starts dipping as an age-related factor, the virus actually wakes up from its dormant state and it gets reactivated. And this is what causes shingles. So the disease shingles was recognized since ancient times, but now it is more common. Why? Because we are finding population above 50 also. Our lifespans have increased and there are a lot of people going into that age frame in large numbers. So that is why herpes zoster is also becoming more common. So the word shingles is derived from a Latin word called cingulum, which means a belt. So a belt it characterizes the rash, which is found like a belt, usually in the thorax region, the upper trunk or the abdomen region, like a belt. Similar with zoster. Zoster is a Greek word, which also means belt. So the picture you see now, to your left, you can see a person's back with the rash that is appearing only on one side of the body. And you can see a line in the center, which is the midline. So in the distribution of the nerves is where the rash appears, because when chickenpox happened in childhood, then the virus is actually situated in one part of the nerve and it is sleeping. And when it gets reactivated, the course in which the nerve supplies the skin, the rashes appear there. And it's a very painful and blistering rash. Many ways of describing this rash. Some people say it's like, holding a flame against the skin. So it's very, after you get a burn, how you experience the pain, it is as severe as that. But a person who's gone through this pain would say it's one of the worst pains and the worst, sometimes even annoying pain, because you cannot stop it in any form. So the virus gets reactivated. That is, if you see the chickenpox, which a child gets, and it initially is called varicella, which is chickenpox. And then these are the nerve endings. This is the spinal cord and the nerve endings. And from here, the virus transfers and reactivates. So we need to find out now, why does this reactivate as we age? So how common is shingles? It is an old enemy. We know of that, and an enemy of the old. So 90% of adults above 50 years of age already have the virus in their body. So what we say by this is that most of the people, because the herpes virus, the varicella virus is very contagious. So in childhood, there is a season, usually during the summer season, that most of the children come across chickenpox. Now we, according to the Indian Academy of Pediatrics, we have chickenpox vaccine given to all children. So most of the children in this era don't have the chickenpox infection. But our age group and older have had chickenpox in their childhood. So this is nothing but, if you've had chickenpox, the virus may be lying dormant in your body. 1 in 3 people can get shingles in their lifetime. Shingles is most common among people 50 years and above, but we do have instances when people have certain immunosuppressive conditions where your immunity is suppressed, can also have higher risk of developing shingles, because your immunity is something that wanes away and then the virus gets reactivated. So how to recognize this initial symptoms? So I'll tell you a case scenario from a clinical experience, that as Mr. Baswaraj celebrated his 70th birthday, he was thankful that he had no serious problems other than mild arthritis in his hands and knees. One summer weekend, he had an odd cramping feeling in his left side of the chest. So we are all aware also that if you have some kind of chest pain, and if it causes sweating and other jaw pain, we do consider it cardiac reason for chest pain. But he also felt it more like a muscle spasm, and he of course didn't have any other comorbidities. Over the next 2 days, the cramping feeling became a burning pain, and that spread from his chest to the back. So if you see, it is on one side of the body. It didn't cross the midline and go to the other side. By the evening of the 4th day, a broad band of reddish rash covered that area. Thinking that this is some form of skin disease, he visited a dermatologist, and the doctor promptly diagnosed his condition as shingles. So the initial symptoms of shingles are what we call as nerve pain. So the nerve pain is typically, it can occur as different forms. It can be like a cramping feeling. It can have like pins and needles sensation, or sometimes even numbness of that area. So sometimes you feel that you cannot, even if you prick it or pinch it, you don't feel any sensations. And it's not overall. It is only on one part, and usually in the trunk, upper trunk, or the abdomen region on the sides. We can also feel itchy sensation because the rash is about to appear, and we can have certain kind of itchy sensation. There is also some people experience stabbing kind of pain, like something getting stabbed, and that is also a way that people express the pain that is felt from zoster. And some people feel unwell. They may have a headache, they may have mild body ache, coming down with a flu-like symptom, not feeling themselves, could be all initial symptoms, which could be any viral. But the characteristic feeling would be this pain on one side of the trunk that you may feel, and appearance of this rash. So in medicine, we like to, quantify things, and there is something called as a pain scale, a McGill's pain scale. And according to the scale, the herpes zoster pain is compared to even more severe than labor pain. So that's the comparison. So 2 to 3 days after the symptoms, these initial symptoms appear, a painful rash will appear on the skin, usually on one side of the body, middle of the trunk, and sometimes the upper face as well, that is close to your eye and cheek. Post developing these rashes, the painful red bumps, and these rashes are very characteristic. Usually it comes as a reddish rash, and then you see bubbles, which we call as blisters or vesicles, very characteristic of any kind of herpes infection, these bubble-like lesions. And they are fluid-filled blisters, as we call it, and will eventually they burst and they crust. If you see the picture, the second picture, you can see crusted lesions. And this rash can last up to 7 to 10 days. That means for it to scab and then completely, become non-infective, it takes around 10 days. So that is all that the rash, actually herpes zoster causes, but there are a few complications that I will be talking about. But why is it important to recognize these symptoms at the earliest? Because there is treatment that we can do within 72 hours that can help this rash to not become very severe. For also long-lasting pain to not appear, we can start people who have this disease on antiviral drugs. So this antiviral drug just stops the virus from replicating and causing further harm and therefore damage to the nerve. It is effective only when started as early as possible after the rash appears, that is within 72 hours. The faster we started, the better. And it is important, if you have any of these symptoms, to contact your doctor at the earliest. It could also be, you don't need to wait for a dermatologist. You can also contact your GPs. So what is the other treatments that are evidence-based for herpes zoster, it is painkillers, because there is a certain amount of pain that comes at this point of time, and certain topical medications. So antiviral, there are certain topical antivirals, but over a lot of studies, it's proven that there may not be a very great benefit by putting the creams, but you can also have certain other over-the-counter soothing lotions like calamine lotions, etc., which can help the itchiness and the burning sensations to come down. It soothes the lesion, and it is also used to relieve the symptoms of the disease. So painkillers, over-the-counter painkillers as well. So once you visit the doctor, these are usually the prescription, and the antivirals are usually prescribed for 7 days. That's the treatment course. But what are the possible complications? So why we are so worried? Because this is, after all, the most common thing that we see is rash, and it comes and it goes. But there are a few possible complications of herpes zoster, which is not very predictable about it. Who are the people who will actually get these complications? So what we see with the most common and most spoken about is post-herpetic neuralgia. That means post-herpetic is after herpes, and neuralgia means nerve pain. That means the pain is not there during the actual active disease when you're taking painkillers. It sometimes reappears, or it continues from that time to many months. So the pain literally arises from the nerves. That's why it's a very annoying and a very morbid kind of pain, which actually decreases the quality of life for people who go through this. Of course, a lot of you have also commented that how, to see somebody suffering from this pain is also very painful. The pain can last for a few months to a year or more than that. And oral painkillers are typically used. So, painkillers come with their own set of hazards to the kidneys, etc., and with the group of people that we will be adding this on. So that becomes imperative. But there are certain painkillers that are also anti-epileptic medicines. That means anti-seizure medicines that can be effectively used for this kind of nerve pain. So why does this post-herpetic neuralgia occur? So what research has shown is that once herpes zoster is affected, and especially if it is a severe form of disease, that means a lot of rash and a lot of pain from the beginning, the person usually may have a chance of getting post-herpetic neuralgia. Around 30% of people getting herpes zoster can continue into post-herpetic neuralgia. And this particularly happens because of the zoster virus destroying the nerves that are there in that particular area because of the virus replication. So in most cases, of course, with the rash, the pain disappears. But who will progress into this? Of course, who are the ones who would get severe disease? If your immunity is low or suppressed due to various things like diabetes or any immunocompromised states like rheumatoid arthritis, for which you're taking medicines like immunosuppressants. There could be cancer drugs that you may be on. And these are conditions where your immunity can be low. And of course, chronic kidney disease. So these are particular conditions where a person may be at risk of developing, even if the age is not a factor for the immunity to be low. So why the preventive action you will see in the next few slides are also recommended for people above 50 years, only because with age, the immunity actually starts declining. That is a natural fact. So with that, the reactivation of the virus occurs, but also that we see a lot of stressful conditions physically or mentally if the person is undergoing, that can also reduce your immunity. And even if you're less than 50 years, sometimes you can get zoster. So what are the rare complications of shingles? Sometimes these rashes, which are burst open, they can get secondarily infected with bacteria. This is a virus-related infection, but it can get infected with a bacteria, and that can cause secondary infections and a very threatening kind of skin infection called cellulitis. And that you may need hospitalization, you may need IV antibiotics for that because it can spread very rapidly. There are also disseminated shingles. This again is very rare. It is seen in people who are immunocompromised largely. In them, disseminated shingles means the rashes can appear all over the body. Once it has occurred from this area, it can spread. Also, there is something called the Ramsay-Hunt syndrome, which is nothing but paralysis of the face. And this is most commonly seen when the herpes zoster occurs around the eye. That is the nerve around the eye is which harbored the dormant virus. So that area gets affected, and therefore also vision problems like swelling and inflammation, or even visual loss. So this is the morbidity that can happen, but not in all people, but a good majority of people can have these complications. So are you at risk of shingles? So how do you assess yourself whether you really are at risk? So are you 50 years of age or older? Have you had chickenpox earlier while in childhood or early adulthood? Have not had chickenpox but have received the chickenpox vaccine. So even with the children who have got chickenpox vaccine, the vaccine also contains an inactive form of the virus. So that will also elicit the antibody response. That means your immunity actually has seen this virus in the body and it's aware. So the next time then it flares up as well, and it is dormant in the nerves. And have chronic diseases such as diabetes, asthma, chronic lung disease, kidney disease, heart disease, HIV, or cancer. These are the immunocompromised state that I was talking about earlier. So any of these checklists, if you do come under, you should be talking to your doctor to understand that what can you do to not get this disease at all. So vaccination can help prevent shingles, right? So anything with prevention, we have to look a step ahead. That means now that, majority, 90% of people have this virus dormant. So how would you prevent this from becoming a very full-blown shingles or herpes zoster? So we have a recently introduced vaccine in India, but this has been introduced in 50 other countries already and approved by CDC and FDA. So this is the Shingles vaccine, which is an FDA-approved vaccine for prevention of herpes zoster in adults 50 years and older. Shingles is not used to prevent chickenpox. So chickenpox vaccine is a separate vaccine which is given in childhood or people who have never got chickenpox. So what are the key details about Shingles, the vaccine? It is a non-live vaccine. So it's a recombinant. So we have certain specific kind of vaccines, how they are made. And this is a non-live vaccine. So which means that we can use it in people with weakened immune systems. People with weakened immune systems are not allowed live vaccines. They can take non-live vaccines. So this can be given. It's a 2-dose regime. That means the vaccine is administered in 2 doses with a gap of at least 2 to 6 months between the 2 doses. It's an intramuscular. That means it is given in the muscle, and it is given through a simple, quick intramuscular injection, usually on the arm. And it's more than 90% effective against shingles and its complications. Most importantly, the complications as well, because we see how debilitating the complications are. So that is something that we have no control over. Even if we start very early treatments, it's difficult to prevent it through the antivirals, because antivirals will only stop the replication. We cannot really predict if it will prevent the complications. So the effectiveness is 90% against shingles as well as its complications. So even people who have got the vaccine, sometimes we see that the effectiveness is 90%. So sometimes there can be infection that they can acquire, but it's usually very mild, and it definitely does not cause complications post the recovery. So I will answer the questions that are very commonly asked questions. So should you take the vaccine if you've already had shingles once? Yes. People can have shingles more than once. If your immunity dips again, there is a recurrence of shingles that can happen. And if that is also severe, and in that time, if you get complications, that is something you want to avoid. So even if you've got shingles in the past, you can take the vaccine. It's not that it's not indicated, you can take the vaccine. And it doesn't mean that once you've got shingles, you've got immunity to it, how we believe with the other conditions. It can come in more severe form as well, depending on your immunity and your chronic disease condition. Are there any side effects of taking the shingles vaccine? There are, with any vaccine, any medical intervention, there are a few side effects. So the common side effects that we see with shingles vaccine is that you have some pain at the injection site. There can be some soreness, that arm pain. Very rarely do you get fever and full body ache like that, very mild. And usually the more severe symptoms also last for 1 to 2 days, and it just recovers after that. So that's the most common side effects. Is vaccines for shingles newly introduced? No, it is not. Like I mentioned earlier in the talk, that it has been approved by 50 other countries already. We have introduced it because they have planned to release it in a phased manner, and now it is available in India. And we know that shingles is a age-old disease. It's an ancient disease. You should consider who should consider taking the shingles vaccine. Like I also mentioned about the checklist. So if you're 50 years or older, you are eligible to take the vaccine. If you have disease conditions, especially diabetes, you are at 40% risk of developing shingles. And we know that 1 in 3 people could develop shingles. So if you're diabetic, if you have any, if you've recovered from any kind of cancers, were on chemotherapy, if you have any immunosuppressive conditions like rheumatoid arthritis, psoriasis, all these conditions also put yourself on risk of about 1.5-fold increase in risk of developing shingles. So people with immunocompromised state, ideally good for them to take the shingles vaccine. Who should not take the shingles vaccine? Of course, if they have taken the shingles vaccine, the person had a reaction to it. That is something that prevents. So any kind of reaction to any of the vaccines before, you don't are not eligible to take that vaccine. By reaction, I would mean what we call in medical terms as an anaphylactic reaction. That means you would have had rashes all over the body, swelling, and a very severe form of allergy. Also, people who are, women who are pregnant cannot take this vaccine. And also that if you're having shingles at the moment, if you've already got the disease at that time, then we don't recommend the shingles vaccine at that time. Of course, if you've had herpes zoster, we need to assess the severity of it. And there is a lot of recommendations. These are not guidelines, but they're recommendations from the CDC, etc., where you can give the vaccine after 1 year of recovery from shingles. So that's the time when you can take it. Where can you get the shingles vaccine? Presently, you can reach out, like what Nidhi has mentioned, that if you want to take the vaccine, you can fill up the form, and we at Bridge Health are administering this vaccine for anybody who's seeking it. So if there are any questions apart from this, Nidhi, you can.
I think I will, if you could stop sharing your screen, then I can pick up, I can ask you the questions which are in the chat box. Yeah. So actually, Dr. Mahesh Himadri, who is joining us from Mount Abu, he has shared that he says that the complication of the zoster vaccine are too many, and that is why we fear advising the vaccine to the elderly. How to make elderly immunocompetent to this disease?
So, of course, improving your immunity, there are two parts in this question. One is that the vaccine has many side effects. From whatever studies we have seen, so there are a lot of studies that have been administered through the Shingrix vaccine over many periods of years, so almost 10 years and more. So in those studies, we have seen that the majority of side effects are very mild, like what I mentioned, like arm pain, a certain flu-like symptom. So these are the only side effects that we have seen with the Shingrix vaccine. Of course, it is a choice that people have to make to get vaccinated or not. How do you improve the immunity? So what we see is post 50 years when the immunity dips, but you could improve your immunity. So how do you improve that? One is that if you have any chronic disease conditions, maintaining those chronic conditions well, that means well in control with medications or lifestyle. And with lifestyle, I would say the regular lifestyle habits that we recommend for all chronic diseases or otherwise is good amount of sleep, 7 to 8 hours of sleep, having better handle over the stress, can be external stress, internal stress, having a healthy choice of diet on most days, and having minimal or whatever you're used to kind of physical activity that helps you keep more mobile and active.
Okay, that's wonderful to know. So you've already answered this question. Maybe we can just remind people about it. What is the maximum gap between the 2 shots of Shingrix?
All right. So the maximum gap is within 2 months of the first dose. Ideally, you can take the second dose. But in any case, if you want to postpone it or you're not able to take it, 2 to 6 months. The second dose should be within 2 to 6 months of the first dose.
And if you've had one shot and then there is a long gap between the two doses, then are you expected to repeat it from the first shot itself?
Yes. So the thing is that with immunity, what happens is why we space these, the doses is that there is a certain response that we predict from the body. So when we give the first dose, there is an the antibody response. And then to boost it is why we give it between 2 to 6 months. So that is something that, you can't replicate. You can't really, replicate that again with just giving a dose anywhere after that. So there's a reason why it is spaced like that. It is better to take it during the, the prescribed timeline. Otherwise, we need to probably repeat it.
Okay. So since you said that, shingles is likely to happen with someone who has had chickenpox earlier, right? So if someone hasn't had chickenpox as a child, they don't need to take the vaccine then?
So they don't have this dormant virus in their body. So they will not ideally, so you cannot get herpes zoster from somebody who has chickenpox now. Like it's not infective like that. So herpes zoster comes when your immunity comes down and your dormant virus reactivates. So it's not an external infection, it's an internal. So if you don't have a dormant virus, then you don't have a risk of developing zoster.
Okay, so I think then you've answered my next two questions. Somebody had asked, is it as infectious as chickenpox?
Yeah, so it cannot be transferred. So suppose somebody has not had a chickenpox, then it is the same virus. So they can actually get it. But you cannot give it to somebody who has had chickenpox. You cannot give them zoster if you are infected with, if you are having herpes zoster, you cannot give that herpes zoster to anybody.
Right.
I hope that is clear.
I think you had answered this question also, but I'll just take this up just to kind of recap it again. Does a person who has already had shingles need to take the vaccine? I think your answer was yes.
Yes. So there are chances where people have got recurrent shingles, and sometimes the second episode could become more severe and debilitating. So it is not that people who have got shingles, they have some kind of protection, because again, they have the dormant virus and it can reactivate. So it just reduces the severity of the infection.
So in that case, if somebody does take the Shingrix vaccine, right, what is the duration for which it stays effective? Is there a time frame for which it can prevent from shingles from coming on?
So in whatever studies that the present vaccine has undergone, it's almost 10 years.
Okay.
Yeah.
So for 10 years, one is kind of safe. And then do they need to repeat the vaccination after 10 years?
We don't have any recommendation on that as of now. I think with most studies, they would say whether a booster maybe after that is required or not. As of now, because it is in that limited age group, beyond an age also that a lot of people don't recommend vaccines beyond 1995. We don't really recommend at that age because we look at the pros versus cons for that. So that's something that we don't have a recommendation as of yet.
Okay. Then Rukmini has asked that do these rashes appear in the throat area or the stomach area? Any other areas?
Not throat, ideally in the upper body or in the lower body, that is on your trunk, either front or back, but it will be on one side like a belt. Otherwise, it can also occur around the eye. That is most commonly there is an ophthalmic nerve that gets affected and you get rashes around the eye. That is a little serious condition, what we called as herpes ophthalmicus, where that can affect the nerve which supplies which takes care of the vision, and we can have visual loss as well. Okay. So that's usually the area where it can occur.
So in fact, one question which was related to the eye infection was, is it also like Bell's palsy? Is it something related?
No. So the Ramsay-Hunt syndrome, what I mentioned earlier, was where the, it also comes, the shingles is present even in the ear canal. And that because the facial nerve, the nerve that supplies the face also transmits through the ear, that can affect the facial nerve and cause paralysis. Bell's palsy is a type of facial palsy. So Bell's palsy is a certain type, but it's not necessary that Bell's palsy is because of herpes zoster.
Okay. And somebody's asked, like, can it affect the legs and feet or any other parts of the body? So you're saying it doesn't go down to that area?
Yeah, mostly in the trunk area, mostly in the trunk area. So
Okay.
because the nerve supply is such that, and most of the time the virus stays dormant in these areas where it comes out of the spinal cord.
Okay. Now somebody's asked, is it painful? I'm guessing they joined the session a little late. So so they've asked, is it painful?
Yes. So the rash per se, if it is coming, it's a very on a scale they say that it's close to even higher than the labor pain, but it can vary from person to person as well, how they perceive the pain. So pain is a very subjective matter, right? Some people have a higher threshold to feel this pain, some people have lower. So this pain particularly is a nerve related pain. So there are different kinds how you categorize it. So this burning kind of pain, it's experienced as holding a flame against the body. And like when you get burnt and there is no visible thing, but you can still feel a very burning pain on your hand, right? The scalding pain. So that is the kind of pain that develops with zoster.
Lakshmi has asked, are there any side effects of the vaccine? You have spoken about it, because her question is also coming from her past experience where she says, I got urticaria after taking the COVID vaccine.
Okay. So there are certain vaccines that, apart from the vaccine, they have certain adjuvants. So adjuvants means things that make that vaccine's content more potent, right? So some people are allergic to those content in that. So in them, sometimes urticaria can occur. So it is always advisable to see that risk with your doctor and then take the vaccine, because the way COVID vaccine is developed and what constituents it has is very different from the and depends on what type of COVID vaccine you've got as well. So that is different from how the shingles vaccine is also manufactured. So it could mean that if you're allergic to that, doesn't mean you're allergic to other vaccines as well.
Okay. Vijay Lakshmi has shared, has a very specific question regards to her mother. She says, my mother took the vaccine after getting herpes. After 6 months of getting herpes, she says, then she took the vaccine a week back. She's feeling unwell with fever, etc. Is it normal to get side effects? But after 1 week also, she's still suffering.
Okay. So then the most common symptoms, side effects that I have mentioned usually last for 2 days to at the max maybe 5 days. If there is relenting fever like that for a week, I would say there could be other causes as well. So that needs to be evaluated. It may not be vaccine related. Usually vaccine related fever does not last for a week. Not with any vaccine. Yeah.
Okay.
So needs to be evaluated. Yeah.
Ravi is asking, is there an upper age limit for taking the vaccine?
As of now, whatever studies we have done with the Shingrix vaccine is up to 90 years of age.
Okay.
So above 90, again, we don't see any cons, but we don't have enough research and studies to suggest that it is also safe. So I wouldn't really comment on that. So less than 90 years, of course, we have evidence and we have data to show prove that it prevents zoster as well as safe to use.
Okay. So I just noticed that Vijay Lakshmi had a follow-up question with regards to her mother's condition. She said, my mother is suffering after taking the first shot. So should she go for the second shot or not?
So it depends on whether this whatever febrile illness that is going on is because of the vaccine or is it something else. So first you need to find out that and not decide that it is because of the vaccine that there is a prolonged illness.
Right.
Right. So before we decide on the second dose, you should evaluate her now and see.
Got it. So here's another question. What should be the gap between the first dose of shingles and any other vaccine like influenza vaccine?
So influenza vaccine, pneumococcal vaccine, and Tdap, which we commonly give in all older adults, can be taken simultaneously with the Shingrix vaccine on different sites. So you can take it in the same visit.
Okay. Okay. That's wonderful. Then Ratna is asking, she's saying, I am not aware that if I had chickenpox earlier or not, and she's 60 years old. So can I take the Shingrix vaccine now since I am diabetic?
Yeah, I think it on benefit of doubt, ideally it is okay to go ahead with the vaccine. Because there, after a certain number of, the period of time, all people have got chickenpox either very floridly or slight symptoms. So most people have been infected in some form. Even if you have grandchildren who have got, chickenpox, slight infection could have happened. So it is okay if you are diabetic, especially, to go ahead with the vaccine. It will not cause any problem because it's after all a vaccine you're taking to prevent the zoster. So if you're in doubt, but if somebody who's never got chickenpox, then there is no way to get a zoster as well.
But is there a way to check for that virus in the body, whether that virus
Yes,
is
you
there?
can. Yeah. So you can check for antibodies. The Varicella-Zoster virus antibodies can be checked in the blood. And that will ascertain there is a certain level above which that means you're immune to it. That means if the antibodies are there, that means you have had the infection. That's why antibodies are produced. If you don't have the antibodies, that means you've never been exposed.
So that can be found out through a simple blood test?
Blood test, yes.
Okay. Saras wants to know, what are the various methods of managing chronic post-herpes neuralgia?
So when you have post-herpetic neuralgia, it's a nerve-related pain. So there are a lot of pain medications, which are also, like I told you, anti-epileptic medicines, which are used for seizures or nerve-related pains, like gabapentin, pregabalin. I'm sure some of you may be taking for neuropathic pain as well. So these kind of medicines are given for a good amount of time, usually 3 to 6 months, because it takes around that time for it to completely suppress and then the pain to relieve. Otherwise, over-the-counter painkillers are also given along with this. So it has an adjuvant kind of effect where the pain comes down as well as the neuropathic pain comes down. These are the most commonly used methods. Anything at home that you can do is that sometimes counter irritation, they tend to apply certain capsaicin related ointments. Like when we apply something with menthol or something which burns, a counter irritant is applied, so the pain actually comes down. There are a lot of physiotherapy also people take in the form of TENS. There are certain methods of physiotherapy to reduce this pain, but it's something subjected to each individual can respond to it very differently.
Okay. So doctor, so this people who have kind of had this experience where the pain has lasted for a longer duration, in all cases, it's that post-herpes neuralgia only, that nerve pain that you're talking about, that lasts for, you said, almost a year. It can last as long as that?
Yes, yes. So that is post-herpes. So that is the complication of zoster. So that can in some people last up to 3 months, 6 months, or in some people up to 2 years. And in a very rare number of people, it can last forever. It just becomes a very annoying pain that is there forever. Yeah, that's very sad, but it's difficult to predict who will go into that phase. Yeah.
Okay. Then there is a question, somebody saying that I have a burning sensation and pain in little fingers of my hands. What could be that?
So I'm assuming it's multiple fingers at a time is what I'm thinking. So if you're having, so when we think of different kinds of pain, so this kind of pain, what you're saying, like a numbness, or you feel like when you sit for a long time, how your foot becomes numb, that's the kind of sensations if you're having, then this could be more related to neuropathy. It could, so there is neuropathy means the nerves are affected in some ways and there are different causes for it. Common causes are diabetes, which are uncontrolled over long periods of time. Even if they're controlled, if your diabetes are more than 10 to 15 to 20 years, then there are chances of the nerves getting affected. One more common cause is B12 deficiency. So B12 deficiency can also cause like a glove and stocking kind of neuropathy. That means only your hands and your feet and up to mid calf, like how you wear socks. In that area, you feel more numbness, more of this tingling sensation. So this could be B12 deficiency as well.
But can it also happen, like, for example, this reminds me, my father has complained of a similar thing where he has this tingling sensation, especially on his thumbs, and he's not diabetic. So are there any other reasons why it can happen?
So if it is specifically only 2-3 fingers, then there is some trauma. So it may be very specific to that finger only. So sometimes repetitive active use of only those fingers for something, like, any usage where you're recurrently using it, that can also damage the nerve, not fully, but partially. So that causes, so when the nerve is trying to regenerate, it will cause these symptoms. So it's good to do maybe a nerve conduction study to understand if there is, what are the wavelengths that are going through there, and is it because of what kind of neuropathy. So there are many types of neuropathy. If it's a long-standing thing going on for a few months, then good to meet a neurologist and get the assessment done, because you want to see whether it's only restricted to that, and especially if he's not diabetic, then you need to look for other causes.
Okay. So Vijay Lakshmi actually has another question with regards to her mother. She's saying, she's asking, will my mother feel some relief from her herpes pain after taking vaccine? Since she still has to take the second shot or something, I guess.
No, herpes pain in the sense she's already got herpes in the past. So
Yeah.
I think she was having a continuous pain. So that pain from the actual infection herpes cannot be treated with vaccine. Vaccine is only prevention. So that cannot cure this. You will still have to take the medicines.
Got it. Thank you so much, Dr. Dhanya. So now, of course, the only question left is where everybody is asking, what is the cost of the vaccine? I think you had a slide on that.
I had a slide on it, one sec. Yeah.
Yeah, so everyone, so this is the actual price of the vaccine. It's been launched in India. Each dose costs about 11,000 rupees. And as Dr. Dhanya mentioned, that there are 2 doses to be taken at an interval of 2 to 6 months. So each dose costs 11,000 rupees. But as part of this collaboration that we have with Bridge Health for the Silver Talkies community, we are actually offering each dose at a special price of 9,990. So you would actually be saving about 1,000 rupees per dose, through this collaboration. And as mentioned earlier, we would be sending out a sign-up form to all of you via email. Look out for that email. Please check your spam boxes in case you don't get it in your email box. And if you would like us to reach out to you, and if you would want to get vaccinated, please fill up that sign-up form. And we are also actually reaching out to different apartment communities, residential communities, so that a full-fledged a similar awareness session can also be conducted, where Dr. Dhanya can come and talk to your co-residents about the ailment, and also we can conduct a vaccination camp on grounds for your entire community. So in the form, you will also find a question asking you that if you would want us to connect with your RWAs or management committees of your apartments, your residential communities, please let us know. If you could get us in touch with someone, then we could reach out and see how we can facilitate that. Right. So I think, yeah, that's primarily the information that we needed to pass on to all of you. We would be holding 1 or 2 more webinars, after this, possibly in other languages and other related topics to shingles. But I hope for now we have given you enough information for you to evaluate and decide whether you would like to get vaccinated so that you do not contract shingles. And if in case there are no more questions, I don't see everybody is actually, kind of thanking doctor for a great talk. So thank you so much, Dr. Dhanya. I think we have covered all important parts, and there are no more questions here in the chat box. In case any